Hi, I'm Dr. James Meschino, and if you're a man between age 40 and 44, a couple of really important health concerns I want to point out to you. Number one, you need to be protecting your prostate gland right now, and also you need to be protecting your joint health immediately. So I'm going to explain those two things to you, as well as a couple of other lifelong components that I think you should be aware of. With respect to your prostate gland, after the age of 40, the prostate gland starts to build up more of a dangerous type of testosterone. It's called DHT. And as DHT builds up, it causes the cells of your prostate to divide at a faster and faster rate. That leads to a larger prostate enlargement. 90% of men are affected by prostate enlargement if they live long enough. But the more serious thing to me is that when those cells are dividing faster, they make more genetic mistakes, and those genetic mistakes are linked to prostate cancer. There's incredible evidence to show that. So that's the bad news. The good news is that we know there are natural agents that can block the buildup of DHT and slow down the rate at which those prostate cells are dividing. I can't tell you how important that is. You want to slow down the rate at which those cells divide, especially after the age of 40. So to do that, you need a prostate formulation that has the agents that have been proven in clinical studies to block the buildup of DHT. Things like saw palmetto, pygeum, beta-cytosterol, stinging nettle, soy isoflavones. I put a formulation together called Prostate 40 Plus. I know that every man over the age of 40 should take it. You can learn more about that formulation on the website, but I just wanted to tip you off that after age 40, it's a primary consideration. And of course, protecting your joints is a big consideration after the age of 40. Why is that? Because your joint cartilage starts to thin out and undergo erosion. We all eventually end up with some arthritic changes as we get older, but it starts at age 40. What's happening exactly? The body stops making optimal amounts of glucosamine, and you need glucosamine to make joint cartilage. So when you don't make as much, the joint cartilage thins out. Studies have shown now that if you put glucosamine back in orally as a supplement, you can give the body the glucosamine it doesn't make for itself, maintain your joint cartilage. But that's not where the story ends. As you get older, the tissues in your joints also produce more inflammatory chemicals. So our joints ache, they get a little more swollen, there's more joint inflammation, and pain lingers longer. Not just because of lack of glucosamine, because we're making these inflammatory chemicals. So you have to put the fire out. The way you put the fire out is with natural agents like MSM, quercetin, and bromelain. So in the glucosamine formulation I created, I put the glucosamine in there with those natural anti-inflammatory herbs. After the age of 40, a product like Glucosamine Joint Formula is in your best interest to maintain your joint cartilage as you get older. There's no foods that can substitute for these things. Now, of course, throughout all of adult life, you want to be battling free radicals. You know about free radicals. They can damage your brain, they can damage your blood vessels, they can damage your eyes, leading to cataracts, macular degeneration. It can cause aging of your skin and produce genetic mutations that can be linked to cancer or cell disruption as we get older. A lot of diseases have free radical components. And the things that combat free radicals, of course, are antioxidants. So in the high potency multiple vitamin I created for Adiva, it doesn't just have everything from vitamin A to zinc, but it's antioxidant enriched to help quench those free radicals with the extra vitamin C and E and selenium and all the other antioxidants that you need all in one formulation, as well as a B50 complex and some extra calcium and bone density building nutrients that men need, not just women. So the Adiva multiple vitamin satisfies that lifelong requirement. And the last thing, of course, for a man in your age group is the right essential fatty acid combination, which is the combination of borage seed with flaxseed with fish oil. Why is that? Together, those essential oils come together and the cells can make really important hormones that do what? Reduce inflammation, maintain normal blood flow to reduce risk of vascular disease, make your skin really soft and smooth, which is a nice secondary outcome, and also slow down the rate of cell division throughout your body. It's one of the most important ways to reduce risk of cancer and to also slow the aging process. So in summary, a man between the age of 40 and 44, you need a high potency multiple vitamin, nature's essential oils with the essential oils in them, Prostate 40 Plus, and Glucosamine Joint Formula. You can learn more about these formulations on the website. Thanks so much for listening.